Yeah, the GDFather-NEO trial was built on the background of the GDFather-01 trial, which was a Phase I study testing Visugromab in combination with Nivolumab in patients with advanced solid tumors already pretreated and refractory to immunotherapy. Visugromab is a neutralizing antibody against GDF15, and GDF15 emerged as a target that was highly expressed in multiple tumor types, including urothelial cancer. And the Phase I data that have been published a few months ago on Nature by Ignacio Melero and colleagues showed that in the cohort of urothelial cancer there was a huge proportion of responses, and responses were maintained as also updated here at the meeting. So GDFather-NEO trial was the first trial in immunotherapy naive patients combining Visugromab with Nivolumab in a randomized study with a combination therapy or Nivolumab and placebo therapy just before radical cystectomy by providing the 3 courses every 4 weeks of therapy. And then the patient have the treatment had also to decide on as to whether to do with the radical cystectomy or RTRBT, so bladder sparing approach that was very much response-driven and patient decision-driven, depending on the response. The primary endpoint of the study was the pathological response rate, and then we also put another primary endpoint represented by radiological response. And the results in terms of primary endpoint was pretty good. 33% of the patients in the combination therapy arm achieved the pathological complete response, 66% achieved the pathological downstaging, a major response to non-muscle invasive disease, as compared to Nivolumab and placebo arm. So the results were tripled in terms of pathological complete responses, and also the same, and it was 4-fold higher in terms of radiological responses, when we have seen 60% of radiological partial or complete responses in the combination therapy arm. Most importantly, the combination therapy was pretty well tolerated. There were no grade 4 or 5 adverse events. The time from cycle 1, day 1 to surgery was in line with the protocol allowance. So it's the grade 3 adverse events reported in both arms were pretty well tolerated and in line with what is expected actually with the checkpoint inhibitor. So globally, it's an intriguing combination, Visu and Nivolumab, and certainly warrant further investigation in the field. It is going complicated, you know, with multiple trials having read out of the data this year at the meeting, but adding additional drug that not at the next toxicity, you know. It's important for combination therapies in these patients in this curative setting.